Hello, this video will review our custom insulin infusion advisors. We created these advisors in order to help improve inpatient insulin management for hyperglycemic states. Our team is pleased to report that these innovations were recognized with Cerner's 2015 Intelligence Connect Award. All of the solutions we will demonstrate today are in production domains at multiple facilities and have led to improved outcomes, primarily reduced hypoglycemic episodes. Our insulin advisors help physicians and nurses effectively manage complex inpatient hyperglycemic states in an evidence-based manner. Using the mPages platform, we were able to build 4 robust advisors. The first and second are diabetic ketoacidosis, DKA, and hyperglycemic hyperosmolar state advisors, or HHS. These are based on American Diabetic Association guidelines. The third and fourth advisors are post-cardiac surgery and critical care insulin infusion advisors. These are based on the Portland Protocol. These advisors have helped standardize and improve care for patients with these conditions at multiple facilities. Let us demonstrate the functionality of the diabetic ketoacidosis order. We have a patient who presented to the ED with a glucose of 550, and he is a known diabetic. The ED provider has started the patient on normal saline, intravenous fluid, and an insulin infusion. Subsequently, labs were sent and the patient was confirmed to have DKA. The order can be placed either by clicking on the advisor folder on the home screen or by typing in DKA. Patient data is available for review on the right side of the screen. This includes the patient's weight, vital signs, relevant labs such as basic metabolic panel, arterial blood gas, and diabetic home medications. Notice on the top we have 2 different tabs. The first one is Protocol Orders. This tab is used by clinicians to place orders. The next tab is Patient Management. This tab is used by nurses to manage the patient. The default view for clinicians would be the Protocol Orders tab, and the default view for nurses would be the Patient Management tab. The protocol content can be accessed by clicking on the top right-hand corner question mark symbol, either by the clinician or the nurse. The same protocol is also available on Forms on Demand for users to be able to use during unforeseen downtime.
The patient has confirmed DKA, and now the ED physician continues to place the protocol orders. The clinician clicks on the protocol orders and notice we have the initial phase and the subsequent phase. The initial phase is intended for ED physician use during the first 4 hours of patient management until the corrected sodium is back. This occurs with resulting of the basic metabolic panel. In rare instances where the patient develops DKA in-house, inpatient providers will initiate both phases. Phase 2 is intended primarily for inpatient providers and starts after return of corrected sodium from the first 4-hour basic metabolic panel. Let's start with initial phase orders. The advisor calculates intravenous fluid requirements based on ADA guidelines. Notice that in this case it is 700 milliliters per hour for 4 hours. The provider can discontinue existing fluids from within the advisor and choose to place the new order. The provider also has the option to modify the fluid rate as clinically indicated. The next section is acidosis correction. In this case, the patient's bicarb is less than 5 and the pH is less than 7, hence you see an order displayed here for bicarb. I will select the order for bicarb and move to the next section, which is glucose correction. In this case, the patient is already on an insulin drip, hence I would ignore the drip order. Since patients' magnesium, phosphorus, and potassium are low, you see orders for all 3 electrolytes displayed. I'm going to select these. Notice we also have options for labs which the provider can order from within the advisor. There is also an option for Notify Provider and a fingerstick glucose. The Notify Provider allows the clinician to customize the alert requirement to their preference. In this case, I am going to select both and I will proceed to sign the advisor. Now I have our ED nurse who is going to demonstrate the nursing workflow for patient management.
Notice that the table of contents now displays the advisor for the nurse. Notice a change in color on the table of contents since a new point-of-care glucose has been resulted. Once the nurse clicks on the advisor launches and displays previous glucose, current glucose, and most recent insulin drip recommendation. If the insulin drip rate is not current, the nurse can exit the advisor by clicking the Exit button and update the rate in iView. The nurse has to validate previous glucose value for the Confirm button to be displayed. Once confirmed, the nurse is presented with an insulin titration change and a prompt for a change in fluid management. Notice there is also an option for the nurse to order a lab and an option to complete the provider notification within the advisor. The nurse then continues to sign the advisor and proceed to care for the patient by following the recommendations. In between new glucose results, the nurse can always access the most recent recommendation made by the advisor by clicking the advisor from the table of contents. I will now hand over the patient's care to the clinician who is proceeding to take Phase 2 orders.
The patient is seen by the inpatient provider and ready for ordering the Phase 2 protocol. The provider can access the advisor either by clicking on the table of contents or by placing the order from the order section of PowerChart. Notice the advisor recognizes and defaults open to Phase 2 orders as Phase 1 orders have already been signed. The advisor displays the fluid protocol rate, which is defaulted to 250 milliliters per hour. The user can modify the fluid rate as indicated. This information is stored by the advisor and the fluid order is presented to the nurse once corrected sodium has been resulted or when glucose drops below 250. The provider has an option to determine when Phase 2 should be triggered by selecting the BMP displayed in the drop-down window. In cases where Phase 2 has been initiated close to 4 hours from the patient's presentation, the provider has the option to trigger Phase 2 by placing a new BMP for now. Since the advisor has logic built in to manage electrolytes, I will proceed to select the protocol orders and the transition diet displayed within the advisor. I will go ahead and sign the advisor, and the patient is now being transferred to the intensive care unit for further management. I have the critical care nurse here who will demonstrate further functionality and workflow in the intensive care unit.
The patient is in the ICU, and if you notice the table of contents has turned yellow, alerting the nurse. Once I click on the table of contents and confirm the previous glucose, notice here the recommendation not only displays insulin titration, but also intravenous fluid change to D5 normal saline, as the patient's corrected sodium has returned. I will go ahead and select the D5 normal saline and discontinue the existing fluid orders. Since patient's potassium is low, notice there is also a recommendation for potassium replacement, which I will proceed to order. Once I sign the advisor, these orders are placed on the patient's profile. The ICU nurse will continue to manage the patient on an hourly basis by repeating fingerstick glucoses and returning to the advisor. A few hours later, new labs have been resulted and the patient's ion gap has resolved. Notice the table of contents turning yellow, alerting the nurse. The nurse clicks on the advisor and notice we have transition orders for the patient displayed. The patient's anion gap is normal, hence you are seeing the transition orders. The advisor calculates total daily dose based on the last 6 hours of insulin infusion rates, which is displayed here in a table for the users to be able to review. The basal and the pre-meal dose are calculated based on this and pre-filled for the nurse. The nurse now proceeds to call the provider to confirm the transition orders. The provider has the option to change the doses or just resume home insulin regimen if clinically indicated. The advisor allows flexibility on the timing of the administration of basal insulin. Once the orders are confirmed with the provider, the nurse proceeds to place these orders, and 2 hours after administration of basal insulin subcutaneous dose, she will be required to discontinue the insulin infusion and the advisor order from the medication section in the order profile. All orders placed within the advisor are displayed in the patient's order profile. The clinician should use clinical judgment to discontinue each order as indicated once the patient is ready to be transitioned off of the advisor. Hyperglycemic hyperosmolar state, or HHS, functions similarly to diabetic ketoacidosis, except for the target glucose range for dextrose administration is less than 300 for HHS and less than 250 for DKA. The transition logic for the HHS advisor is based on serum osmolality, unlike DKA, where the requirement is the closing of the anion gap. This concludes the demo.